Hi, I'm Dr. Ramsey, and I'm back with the supplement series. Yes, we did the liver detoxification one first. Last time I did the digestive enzymes and assimilation in our gut. Today, I want to talk about electrolytes. Electrolytes are minerals. Minerals are essential for our body's health. I think of it, and it's not just this way, but if you think about muscle cramps, those are a mineral deficiency all the time. So, our heart depends on minerals. The one mineral I'll talk about first is magnesium. So, magnesium is essential for heart health, for muscle cramps, for relaxation. It helps our mind relax. And we have two forms of it, right? So we have the same, they're the same product. There's three different types of magnesium. So reactive magnesium capsules, four of these equals one scoop of the reacted magnesium powder. This tastes very good. It has monk fruit in it, not sugar. Sometimes it's a little sweet for me. I go back and forth, but I always take magnesium. Some people will use magnesium as a laxative. It is a laxative at higher dosages. I just want to share this one story because this will help you understand the importance of magnesium. One of my patients, he had passed away, but he was a patient for a long time and he had severe heart disease. And when I saw him one day, I gave him magnesium capsule and I said, start with one at night, increase every night because he also had not just heart disease, but severe constipation. Increase every night until you have regular bowel movements. And he called me up and said he required 17 capsules. So, of course, we moved over to the powder. But so not only was that helpful for him to get rid of waste, we know how important that is every single day. It also was really helpful for his heart. So, magnesium, if you have muscle cramps, if you have fatigue, if you have anxiety, magnesium is really great for all of those things. There's another one that we have that's magnesium and potassium. We don't sell this one very much, mostly to men, because potassium in my practice, in my female patients, is very high because most of them, 90% of my females that I treat, are on something called spironolactone. I take it too, it's a medication. It prevents side effects from testosterone. It raises potassium. So women do not need to take potassium on spironolactone. So this is not as big of a seller as our magnesium, but men take it. And once in a while, a female will take it, especially if she's not on spironolactone. So we have other ways to take in minerals more than just potassium and magnesium. And that is, I'm going to start with actually this salt we all love. If you've been a patient for a long time, you know this is our favorite salt to use on all things as we cook and as we drink. So this is called Redmond Real Salt. It comes from Utah. And the minerals in this, it's very interesting. So in our body, we have a certain ratio of each mineral to each other in our body. It's not a 1-to-1 ratio. And this salt, same as sea salt, this is earth salt, has the same exact ratio. So it's medicine for us. In this type of salt that's not bleached white salt, table salt, lowers blood pressure instead of raises it. People always ask me, is that going to raise my blood pressure? I've never seen it yet. So, this is also wonderful to saturate all of our minerals. And just like magnesium, too much of this is loose stools. Too much is loose stools. So, back off if you start to get it. Another powder form of minerals is called ReLyte. It comes in several flavors. It's a sweet, salty flavor. Monk fruit, again, not sugar. Some people really like that sweet, salty taste. Mango is my favorite. And so you put that in your water as an electrolyte drink. If people have diarrhea, they're losing their minerals. Like I said about muscle cramps, if you're fatigued, you might have low minerals. In fact, one time when I was drinking my Soleil here at work, a patient saw that. She's also a friend. We met for dinner and she said to me, "What did you give me to drink?" Because she tried it. I said, "Salt water." She said, "Oh my God," I had an immediate sense of alertness in my brain, and it was just simple salt. So, salt is so important for us, and people who eat low salt diets should at least consider drinking salt. So, ReLyte is another option. My last option here, anyway, for electrolytes, and there's so many online that you can buy, is called Reacted Multi-Min. This has all the minerals for people who don't want a powder. They just want to take a capsule. In addition, the first ingredient on this is calcium. So you need calcium and all the other minerals if you take the reactive multi-min instead of powders, instead of just magnesium, or instead of just magnesium and potassium. We need minerals as much as we need digestive enzymes and liver support. Thank you so much for listening. Bye bye.